Today, we're going to take a quick look at how depression in children and teenagers is treated, what works, why it works, and what to do if you're concerned that you or someone you know might need help. Treatment for depression is available and it works, but starting the process can be hard. Often, the depression itself gets in the way. The same symptoms that define depression, hopelessness, exhaustion, being easily overwhelmed, can make it hard for kids who are depressed to believe parents when they say treatment can help. But the thing is, it can and does. And that's why getting someone who's depressed the right treatment is so important. Treatment for depression isn't one size fits all. It will depend on how severe their symptoms are and what works best for your family. In most cases, when symptoms are mild, therapy is recommended and medication can be added if that doesn't help enough. For severe symptoms, when kids are very distressed and it's having a big effect on their lives, the recommended treatment will be a combination of medication and therapy, which has been shown to be more effective than one or the other by itself. This is because, though the medication can help correct chemical imbalances in the brain, the skills taught in therapy can help kids learn to manage emotions and care for themselves in a healthier way. So what should you expect when talking to a clinician for the first time? Start by finding someone who makes you or your child feel comfortable and heard. Having a good relationship with a treatment provider helps kids feel more engaged in the treatment process, and the more involved they are, the more likely it is that the treatment will be successful. Before your child can be treated, a clinician should perform an evaluation. Evaluations help make sure that they really do have depression and not a different mental health challenge that can sometimes look like depression. It also helps the clinician see if they also have another mental health or learning disorder, as many kids develop depression when they have been struggling with something like anxiety, ADHD, or an unrecognized learning disability. If a child does have multiple disorders, then their clinician will come up with a treatment that includes help for all of them. A good clinician should clearly explain the goals of treatment and make you feel like your questions and needs are being taken seriously. One of the first things I do with a new patient is try to establish a good rapport. You get to know the person, you make them comfortable, you establish a safe space where you show them that you're listening and you care. Often enough, we're the first person that's actually listening to them in a way they haven't experienced before or have not experienced often. Some kids may be resistant to treatment. Maybe they've had a difficult experience with therapy before, or they don't really trust adults, or perhaps they are shamed by their behavior or what they're feeling and they don't want to show it to another person. Whatever the reason, a good clinician will try to address this resistance, explain how treatment works, and why it may be different from a previous experience, and help kids get on board with the treatment process. We talked a little about the importance of therapy in treating depression. Let's take a closer look at the kinds of therapy you might see. Therapies that have been studied and are clinically proven to be effective in treating this disorder are called evidence-based. First, let's talk about cognitive behavioral therapy, or CBT. Cognitive behavioral therapy is the gold standard therapy for treating children and adolescents with depression. CBT works by giving people skills to cope with symptoms like depressed mood and unhelpful thoughts. For example, no one likes me, or things will always be like this. In CBT, kids and therapists actively collaborate to set goals, like catching those unhelpful thought patterns and improving problem-solving ability. A big part of CBT is teaching people that their thoughts, feelings, and behaviors are all interconnected. And so changing one of these points can change all three. For example, one technique, called behavioral activation, encourages people to participate in activities and then observe the effect it has on their mood. Another form of CBT that is effective for depression is called dialectical behavior therapy. DBT was created for people who have trouble managing very painful emotions, including suicidal feelings, or are engaging in risky or harmful behaviors, including cutting and suicide attempts. To manage these intense emotions, people participating in DBT learn to practice mindfulness. This, put simply, is working on being fully present in the moment and focusing on one thing at a time without judgment. DBT also helps develop problem-solving skills like tolerating distress, handling difficult situations in a healthy way, and interacting more effectively with friends and family. DBT is a highly structured treatment that includes individual therapy and skills groups for kids, and often includes sessions with parents. Another type of therapy often used to treat less severe depression is interpersonal psychotherapy, or IPT. Depression takes a toll on relationships, and interpersonal therapy works by helping kids build the skills they need to have healthier, more supportive relationships, communicating feelings and expectations, building problem-solving skills for handling conflicts, and learning to observe how their relationships might be impacting their mood. There's also a special form of IPT called IPTA that has been adapted for adolescents with depression to help address common teen relationship concerns, including romantic relationships and problems communicating with parents or peers. IPTA is typically a 12 to 16-week treatment in which parents will be asked to participate in some of the sessions. Finally, let's take a look at mindfulness-based cognitive therapy, MBCT. Like DBT, MBCT works by combining cognitive behavioral therapy, CBT methods, by using mindfulness techniques to help interrupt the undesirable thought patterns that can maintain or lead to a depressive episode. For example, being self-critical or fixating on negative things. MBCT was originally developed to help people with recurring episodes of depression, but it can also be used for treating a first episode of depression. Therapy is a powerful weapon against depression, but for many kids, medication is also an important part of the equation. Meds often come into play when kids are severely depressed or when therapy alone doesn't seem to be making progress. Medications most often prescribed to treat depression are what's called selective serotonin reuptake inhibitors, SSRIs, like Zoloft, Prozac, and Lexapro, and serotonin norepinephrine reuptake inhibitors, SNRIs, like Strattera and Cymbalta. When you hear people use the term antidepressants, these are often the medications they mean. SSRIs are not the only medications used to treat depression, but they're the most commonly used because they've been shown to be most effective in kids with the fewest side effects. SSRIs and SNRIs do have side effects, including nausea, headaches, and some trouble sleeping, but they usually diminish after the first few weeks. To find the right dose for your child, a clinician will start with a small dose of medication and increase it every week or two until an effective level is reached without unpleasant side effects. You may have also heard that there's a potential for antidepressants to cause or increase suicidal thoughts. This is rare, but it can happen. However, many studies have shown that the benefits of antidepressant medications outweigh the risks, as untreated depression is linked to suicide, so they are still prescribed to young people. And to keep patients safe, a protocol has been developed to help prescribing clinicians closely monitor patients for any worsening in depression or emergence of suicidal thinking as they are adjusting to a new medication. It can take a while for a patient to start feeling the full effect of an antidepressant medication. The medication might start to work at 4 or 6 weeks and continue to work better and better for some weeks after that. If a medication isn't working by 6 weeks, or side effects are a problem, your clinician will likely try a different SSRI or SNRI. Children respond differently to different medications, so if the first doesn't work or the side effects are unpleasant, an alternative may be used. Let's finish up by talking about the family's role in treatment. Families should always be involved in the treatment of a child's depression. Part of treatment, especially in the beginning, is to teach parents about depression and how therapy works. It's really important that parents understand the concepts behind the treatments so that they can coach their child day to day to use the skills that they're learning. Parents often find that they benefit from learning the skills as well. Clinicians can also be helpful in giving parents tips on interacting with a child with depression, which can sometimes be difficult. Children with depression might try to isolate themselves from family or interpret even well-meaning parental concern as critical rather than loving. Knowing how to be supportive is important. Clinicians will help develop a situation-specific plan to help you know when to lean in and when to back off. And, of course, as soon as a child starts feeling better, their parents will start feeling better too. Though it's also important for parents to take care of themselves. This might look like finding a support group, going to therapy, or making time for some self-care. Whatever it is, remember that caring for yourself is an essential part of caring for your child. To learn more, head to the Child Mind Institute's Family Resource Center at childmind.org, where you'll find hundreds of articles and guides to help you support children who are struggling with mental health, behavior, or learning challenges. I'm Dr. David Friedlander, a clinical psychologist at the Child Mind Institute. Thank you so much for joining me today. If you find this video useful, please like and subscribe to the channel below.